I'm nominating Fresh for a Collaborative Leadership Award in recognition of the extraordinary achievements they've made in bringing partners together across the whole of the North East, focused on tackling the issues around tobacco, which is our biggest killer in this region.
Fresh has been working for the last 10 years across the North East to tackle what is our biggest killer, smoking. It's a really small team, but really importantly, we're working with hundreds, if not thousands of others across the NHS, amongst our 12 local authorities, the private sector, third sector, because we've recognised that tackling smoking isn't just the business of the NHS. The North East has made really good progress over the last decade, and we've seen a decline of over 1/3 in adult smokers, and our youth smoking rates are down to an all-time low. But the reality is, today, 15 local people will die from a totally avoidable smoking illness. So it's really vital that we maintain our commitment to this, we keep this as such a key priority to tackle health inequalities, and the Fresh team will not let up until we really have made smoking history for all of our communities here in our region. Thank you.
Jeanette's worked in screening for over 25 years. She started in the breast screening programme and has developed her skills managing screening programmes to include bowel and AAA. And the thing about it is that she manages the complexities of screening programmes to get the call and recall system, to get all the stakeholders on board, with making sure that at the end of the day, every individual who comes for screening is well cared for and informed.
I've worked in screening nearly all of my career, and I've seen it as a wonderful opportunity. I've worked with so many different people in acute trusts, the community, public health commissioners, and really importantly, the public. A lot of my screening programmes are new, and so I've had to work collaboratively, not just in this region, but in Preston and Cumbria, and it's been really exciting to meet new people. Really, my role is to bring everybody together so we can learn and we can motivate everybody to see the benefits of screening the same way that I do. There isn't an I in team, and I really see this award as a recognition for everyone in my patch.
She communicates all the time. She has multiple people to talk to, not just within the trust and the people actually doing the screening. She's got to bring on board the GPs, other hospital trusts, and above all the public. And she works with everybody and she picks on everybody's best qualities and uses them.
Pulmonary hypertension is a rare but very severe disease. It's a devastating disease for patients and very rapidly can lead to disability and death. The reason I've been nominated for this award is because of my pioneering work in setting up services for patients affected with pulmonary hypertension. Not so long ago there were no such services in the UK or the North East. But I recognised the need for these patients. I set up a team to provide a service for patients in Newcastle, but also recognised on the wider field that we would need services throughout the country, and largely through work done by myself and colleagues that I brought in, we set up the national service, now supplied by 6 trusts throughout the UK. And the important issue here, and why I've been nominated for this collaborative award, is because I've very much set up a national collaborating service. They don't only collaborate to provide high quality, top quality service for our patients to meet their clinical needs, but I also recognise the value of setting up a national database and coordinating national research. I also recognise the value of working with patients and patients' organisations, and we are now very much working hand in glove with the Patients Association. So what I think we now have in the UK is a service that is seen by many throughout the world as the way in which pulmonary hypertension services should be delivered for patients.
Very early on in his career, he recognized the need to develop specialized pulmonary hypertension services, both locally in the area, regionally, and eventually nationally. With his vision, commitment, attention to detail, he succeeded in developing this in a collaborative manner with members of teams and specialists across the country. He also was instrumental in driving and developing and working together with patient groups to bring the best of what can be offered in this very difficult and challenging area of respiratory medicine for the benefit of patients across the country.